Welcome to the program, Dr. Stanton.
Thank you for having me.
So we're in the month of September, and during this month we observe childhood cancer. And I know many persons know of this, but I don't think too many persons understand what this means in reality. Could you tell us what are childhood cancers or cancers in children?
Okay, so as the name suggests, it means that there is a type of disease process that is occurring in our pediatric or kids population, and it may affect how that child's body produces blood products, and if that child has any abnormal proliferation of cancerous or an abnormal tissue in the body. What cancer tends to do is use all of your resources for itself to grow while depriving that person of what is necessary for them to be healthy.
Wow, this month we observe childhood cancer under the theme Unveiling Challenges. What does this mean?
So I think it tries to bring attention to what are the inequalities with regard to resources that can be accessed in developing countries as opposed to what is out there in developed countries. So things such as imaging modalities or medications or access to excellent facilities that have lots of oncologists and specialists that deal with particular types of cancer. So once we are now aware of what that disparity is, we know how we can put measures in place to correct it or to ensure that any child that has cancer has the same access to care
And treatment.
in Guyana or a developing country as opposed to another country.
Definitely. I know that there are various types of cancers, especially in children. What are the types that you guys see on a regular basis and the ones that are most prevalent here in Guyana?
So common cancers that are seen worldwide and similarly in Guyana include the leukemias, followed by brain tumors, and then next lymphomas. The other types of cancer that can affect various parts of the body, including things like Wilms tumor or tumors of the liver, are not as common here as worldwide, but we do see them from time to time in our service.
Okay, thank you, Dr. Stanton. What it is, or what do we want persons to take away during this month's observance? What should they know? Whether parents, guardians, whoever it is, what do we want them to take away during this month?
So there are a number of things that I think we can highlight during this time. First, I want to raise awareness of the fact that children can get cancers. We must put that out there. And so if your child is quite often sick or getting treatment for a particular condition and not resolving as we expect that they should, then you should always keep at the back of your mind that that may be a possibility and seek a specialist consult. Things like having frequent or prolonged fevers, frequent infections, even having a family history of having cancer, being immunocompromised in any way. And that would include having congenital types of immunodeficiencies where their body's immune system is not strong, or even acquired immunodeficiencies such as HIV. The other thing that we need to know is that for kids that have cancer, although they may not be able to tell us how they feel, we should be aware that what they're going through is something very difficult. And it's not just difficult for the patient, but it's also difficult for their family members. It puts a significant mental, physical burden, financial burden on that family. And because of that, lots of families struggle with continuing to have their child come for treatment. So they may be living far away from a hospital, or they may have other kids that they need to look after. They may be the sole financial
Contributor,
provider
yes.
in that family. And so if one child has cancer in the family, that's quite a bit of a burden. And so as outsiders, as a neighbor, a friend, a relative, etc., we should be aware that they need help, even if they're too strong or too, prideful to ask
Yeah.
for help. They need help, even if it's just to have a sit down with them and talk. Or they may need sometimes financial help. They may need somebody to help them look after the other kids while they go to the hospital to get treatment. And you don't know what even just one kind word
Yes.
can do for that family. So those, I think, are two of the main things I want to bring to the fore.
Definitely, and that support is very much important. We'll be right back with more on childhood cancers, prevention and treatment.
Have you heard about the school health program? This is a partnership between the Ministry of Health, the Ministry of Education, and the Mount Sinai Health System. Through this program, the Health Ministry aims to provide children from nursery to secondary with early health screenings. This program ensures that your child receives a comprehensive health checkup at least once in nursery, primary, and secondary school. This includes a physical examination, eye and ear exam, dental checkups, and growth and development monitoring. Early screening gives the health system an opportunity to provide effective treatment by catching any potential health problems early, ensuring your child starts life on a healthy note. Parents and guardians, with your support and consent, we can help pave the way for healthier children with bright futures. To learn more about the school health program, contact us at 227-4357 or visit our social media platforms. A message from the Ministry of Health.
Welcome back. For those of you who have just joined the program, today we're talking about childhood cancers, prevention and treatment. And with me today is Dr. Stanton from the Georgetown Public Hospital Corporation. Dr. Stanton, could you tell us about some of the services you guys offer at the Pediatric Medicine Department of GPHC?
Okay, so I would say there are two big branches in pediatrics itself. One would be the medical aspect of things with regard to identifying a potential person that has cancer. And then we have surgical intervention that may be necessary and helpful. And that's our surgical team that would be assisting in that regard. For the medical persons, what we would do is deliver the therapy that we need for the kid. We would screen for, or at least work up or investigate initially as to what condition they actually have, confirm our diagnosis, and then offer treatment for them. We have an isolation area that we house our pediatric cancer patients, where we try to use that as our delivery area for treatment and to house them a bit away from other patients that may have infectious diseases that they're at risk of acquiring. When we suspect that a child has one of the commoner types of cancer, it may involve taking multiple samples of blood, doing biopsies, whether it be a bone marrow aspirate or bone marrow biopsy. But if we need a much more substantial amount of tissue, we would refer to the surgery doctors, and then they would perhaps take out a lymph node or take out a biopsy of suspicious tissue. So once those things are done, our lab becomes quite important in that they help us to identify abnormal cells. Our pathology lab assists us with reading the biopsies and then sending the samples for additional testing. I think one great breakthrough that we've had recently is now having access to doing flow cytometry testing. So with that, we can use blood samples to test for even just a few cancerous cells can be picked up. That previously was not available, and so you had to rely on getting the bone marrow aspirate and biopsy, etc., as one of the only ways of diagnosing an acute leukemia. But now that we have this facility, it makes things a little bit quicker for our time of suspicion to diagnosis.
I know many parents and guardians might be wondering, are there any early signs and symptoms of any of these cancers in children?
So, with regard to what we see most commonly, many of our patients would complain of having fevers that sometimes may be related to an infection that they have, but in many cases, they may not have a specific infection that you're able to detect. They may have been treated for an infection before and then quickly get another one, or have multiple infections at the same time. And that's a key indicator of a poor immune system, where you can have serious infections and more of those than one at the same time. For persons who have a strong immune system that don't have cancer, they usually may only get one infection, if any, may not be as severe of a presentation, and then they're able, with a shorter course of treatment, to get better. And we see quite the opposite in somebody who has cancer. Some patients have also presented with multiple swellings on the body, particularly lymph node swellings. And our lymphatic system is there to help us detect and fight off infections. But in this case, because it's unable to really do so, we tend to have an increase in the swellings or the lymph nodes, and an increase in their size as well. And once we see that, we have quite a bit of a suspicion for that. Just as in some adults, you may have the presentation of an abnormal swelling in the body, you can have abnormal swellings, or what we refer to as tumors, that can occur at various spots in the body, some on the face, or any other part of the body. Yes. And once you find that, then we offer to do a biopsy. And then some kids may also complain of having bony type pain. So it may not necessarily be of the joints, but along the bones itself may be quite painful. And some persons liken it to how arthritis presents in older persons, where it's quite intense and debilitating. So they may not want to walk or move about because it's so painful. And then for other kids, they may also have changes in their appetite. And I think that's one of the things that lots of parents notice, because you know when your kid is healthy, they eat. Or you know that, okay, they're usually picky, but not this picky. So why are they not eating? Why is there a loss of appetite? Some may also have drenching night sweats. And it may be in the absence of the place being hot. So you might have on a fan or the AC, and even with that, they sweat profusely.
Wow.
So those are, some of the things that we may hear parents report, or the child actually complains of those. And then we go looking and find issues with the blood and so on.
HPV, or human papillomavirus, is a common virus that can lead to various cancers later in life, including cervical, penile, anal, and throat cancers. HPV infections are incredibly common, with almost everyone contracting it at some point in their lives. The HPV vaccine series can protect your child from certain cancers and is most effective when administered before exposure to the virus. Therefore, we recommend vaccinating your child if they are between the ages of 9 and 15. HPV vaccines are safe and effective and are available at all health centers nationwide. Don't wait. Protect today for a healthier tomorrow. Get vaccinated against HPV now. A message from the Ministry of Health.
I know that you would have mentioned earlier that the leukemias are the most prevalent here in Guyana. What treatment is available for those?
All right, so chemotherapy is the modality that is primarily offered, not just in Guyana, but worldwide. And for most persons that present quite early and we start treatment, they tend to have a fairly good response. By chemotherapy, we mean medications that can be given through various routes. So things that they may have to drink or have injected in order to attack the cancer in various ways. Obviously, with chemotherapy, it's not something that's quite easy to receive. There are multiple adverse effects that can happen. But the fortunate thing is that most of the drugs that we have potential things that we can do to help with those symptoms. So if they feel nauseated, we have treatment for that. Or if their blood counts drop, you can have transfusions. We might expect things like loss of hair. Many pictures, when they talk about cancer, you show somebody without any hair at all. But it doesn't necessarily happen in that it all falls out all at once. It may be patchy alopecia where the hair falls out in bits, and most persons choose to cut it off during the time of treatment. And the fortunate thing, and I do say to kids because it's quite important to them, is that after treatment it grows back. May not be the same type of hair because it changes a bit, but it does grow back. And so I know parents are often quite concerned about getting or having their child receive treatment for cancer. But I mean, the alternative is that you don't treat it, it just gets worse. And then the other aspect of it is that there is radiation therapy that is available with subsidies that are applied through the Ministry of Health. So they can have directed therapy for things like classical Hodgkin's, for example, where they have radiation that's given to that patient. And then, of course, all of the necessary follow-ups in terms of imaging studies. So CT is available now at the hospital. And then MRIs can also be ordered.
For many parents, knowing that their child may have cancer, that can be quite a challenging period and a very uncomfortable experience at the same time. But what can they expect whenever they visit the pediatric facility for treatment?
Our resources in terms of support for family members would include having our social worker available to families. So even at the time when we're doing some amount of investigation to make that diagnosis, we have families have a chat with our social worker just so that they can share their concerns and they can vent their frustrations. Because many times by the time they get to our facility, they've already had a child who has been sick for a long time, and it's been quite stressful on them and on the child as well. Beyond that, we do provide access directly to the physicians. So once that diagnosis is made, they have a number that they can call in the event of any issue while the child is at home, or if they have a query with regard to medication or so on. In terms of support at the facility, we do have nursing staff who are aware of what the treatment entails and what potential side effects can happen, and also treatments that they can give to help to remedy that. And then our pharmacists, I would say, are the backbone, or quite the personnel that support us a lot in ensuring that medications are present for treatment for those kids. Of note, there are some charitable organizations that lend help particularly to our oncology patients. And again, during the time of diagnosis and getting treatment started and so on, they need not only financial support, but sometimes some of the charities provide books for the children to read. They may provide toys for them to play with. Some have even donated televisions for the room so that they can look at it. And so, in different ways, we have different avenues where they can get some sort of support from the hospital itself.
Definitely. How can parents support the mental health of their child throughout that entire process?
So I would encourage all of the parents to be quite open with their children. I think because they're kids, persons often think that they're not fully aware of what's going on. And it may be so for the younger kids. However, they are aware that they feel unwell. They know that they don't want to be in the hospital. But if the parents are able to encourage them that, if they come and they get some treatment, they'll improve, they'll get to go home, they get to, interact with their family members and so on. It gives them something to look forward to. It allows them to know that their parent endorses the treatment,
yes,
and supports what they're getting, and that it's for something that will make them feel better. And oftentimes, even those few words from a supportive parent goes a very long way, because we often see that how many of our kids react is a reflection of the fears that a parent might have or their concerns that they might have. And having a positive attitude in the entire matter really improves both how that child is doing and that parent. And it also helps us to support them in that way too. Because once they're receptive to treatment and we talk to them about it, then the child knows more and they feel more comfortable and less afraid.
Yes. Before we wrap up today's program, do you have any final words to our listening and viewing audience?
As we're observing Childhood Cancer Month, I would say, in your own way, see how you can be supportive or helpful to families who are there going through that struggle. Again, it might just be a kind word, and that's what you can offer. But in other cases, you may be able to do something a bit more. If you want to mobilize your church group or your friends to make a donation to the children or to their families, if you want to help them in terms of giving them some money to have transportation to go to the hospital, even something as simple as that can make a big difference in their life. So I would encourage you to reach out, ask how you can be helpful, and that may make the situation even a little bit better for these families.
Thank you so much, Dr. Stanton, for joining me in the program today. And I want to encourage you and your colleagues to keep up the good work that you guys have been doing.
Thank you for having me again.